Okay, I have right at 3 o'clock. So, all right, welcome everybody. Hopefully you can see the screen in front of you, which is our Michigan Opinion Leader Forum webinar. We are excited to have you here, I am Rhiannon Marshall-Klein. I work with CB340B. I'm the manager of regional directors nationally, and I am the regional director here in Michigan. I am here in Lansing, Michigan, in actually Mason, about 20 minutes south of Lansing. We are a proud Michigander family here, so excited to have everybody on the webinar. I'm going to introduce to you Peggy Tai, who is a principal at Powers, Piles, Rivel, and Sutter, and she works with 340B, with CB340B as well on our grassroots efforts. So go ahead, Peggy.
Thanks, Rhiannon. Again, this is Peggy Tai with CB340B and Powers Law Firm. Welcome, Michiganders. Welcome, friends of Michiganders, to our webinar. We're very excited to host this today and appreciate your participation in what we've come to call our Opinion Leader Forums. You see here on the webinar that we have a fabulous host today, which we'll talk about in a moment. We also have a couple of wonderful provider organizations, 340B organizations, which we'll describe in a minute, who are supportive of this effort and what it is we're doing to try to help educate folks about the 340B program. Moving on. The next slide, Rhiannon.
So this is our 340B video, and we are going to have Kathleen Collins go ahead and share her screen with us.
Yeah, let me just explain what this is. This is a fabulous infographic video that in a nutshell describes what the 340B drug pricing program is in a very simplistic form. So Kathleen, when you're ready, if you can take it away and hit the video.
What is 340B? To find out, let's go back to the early 1990s. Money was tight, as it always is, and it was a difficult time for America's safety net providers, those providers treating large numbers of poor and uninsured patients. So as part of the Bipartisan Veterans Health Care Act of 1992, Congress created the 340B drug pricing program. The 340B program allows qualifying safety net providers and certain qualifying hospitals to buy prescription drugs at discounted prices from drug makers. As Congress stated, the goal of the program was to enable these entities to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. And since 1992, that's just what 340B has done. Let's explore how 340B actually works. Here is a small clinic in Ohio that participates in the 340B program, and two of their patients, Bob and Tina. Now let's say a 1-month supply of a diabetes drug costs the clinic $1,000 from a drug maker. Tina has private insurance, which pays the clinic $1,100 for her medication. Now, Clinic A has $100 in income, but with 340B, the clinic can buy that same drug from the same drug maker at a special lower price of $600. With 340B, the clinic still gets paid the $1,100 by Tina's insurance, but the sale now generates $500 in income, which the clinic must use towards its expenses. Now, along comes Bob, another patient at the clinic. Bob doesn't have insurance, but he needs medication too. Fortunately for Bob, the clinic now has that $500 in 340B savings to help pay for his treatment, and that $500 hasn't cost taxpayers anything. Without 340B savings, many clinics and organizations would have to find new money to stay open, most likely from taxpayer dollars. Either that or the clinic might be forced to send away patients like Bob, and those patients go untreated. Or worst of all, the clinic could close down altogether. But thankfully, clinics and their patients thrive with 340B because it allows clinics to offer better means of treating and keeping patients in care. The 340B program is already well regulated by the Federal Health Resources and Services Administration, which established rules that manufacturers and providers must follow to participate in 340B. Congress also keeps a very close eye, and 340B safety net providers and hospitals are subject to oversight oversight, monitoring, and regular audits. Smaller safety net providers like Ryan White Clinics, who treat patients living with HIV/AIDS, are concerned because the mechanics of 340B are often questioned or reevaluated by lawmakers and challenged by drug makers that would rather sell their products at a higher price. The truth is, this small program that does a world of good only accounts for 1.3% of all drug purchases in the U.S. We want to protect the vital assistance 340B gives to Ryan White Clinics and all safety net providers. 340B has been working as intended for safety net providers and their patients for over 25 years. And that's why we'd like Congress and elected officials to simply let it be. To get involved and find out how to protect 340B, visit let340b.org.
Great. Thank you, Kathleen. Okay. Let340b.org, just so that everybody knows, is a sister organization that works on this exact same drug pricing program, the 340B drug pricing program, that helps to get the word out about the good that it does. So definitely check them out as well. Here we have our agenda. I wanted to let everybody know what we're doing. It's nice to know where we are going and where we've been. So our opening remarks will be by Brian Peters, who is the Chief Executive Officer of Michigan Health and Hospital Association. Then we're going to be talking with John Shasky, who is the Government Affairs Officer at Sparrow Health. Peggy is going to hop back in, and she's going to give us a little bit of missions and goals for our CB340B organization so that you can understand a little bit more about who we are and what we do. Our safety net provider perspective is going to be given to us by our host today, which is Henry Ford Health System, Alexander Mansour, and then also the president and CEO of Upper Great Lakes Family Health Center, Donald Simila. And then at the very end, I'm going to come back and talk to you a little bit about advocacy. So that is where we are headed. Okay, and I see that Peggy, you are ready to tee up our wonderful Brian.
I am very excited to introduce our opening remarks coming from Brian Peters of the Michigan Health and Hospital Association. Those of you who work in the hospital space or the 340B space in Michigan probably know him. And we think obviously very highly of him, and he is a huge supporter, and his hospitals are huge supporters of the 340B program. Not to steal all his thunder, but just to thank you for your commitment to the 340B program and to community voices. Go ahead, take it away, Brian.
Well, thank you so much, Peggy. It's wonderful to hear your voice, and Rhiannon also, thank you. And I'll do a quick sound check. I trust you can hear me loud and clear.
Yes, we can.
Perfect. Well, thank you again, and good afternoon, everyone. This is really a pleasure for me to be a part of today's program because, as Peggy said, and it's absolutely true, the Michigan Health and Hospital Association is a huge supporter of the 340B program. We've been working on 340B issues for a number of years, and I can tell you, as someone that gets around the state of Michigan and visits with large hospitals, small hospitals, health systems, other safety net providers, that this truly has become one of the most critical programs in the state of Michigan and certainly around the country in terms of assuring access to care for everyone in the community. And I will tell you that the MHA is very proud to partner with not only the American Hospital Association, with 340B Health, and certainly with Community Voices, 340B, and today's program. But we communicate directly with our member hospitals and health systems throughout the state on a very regular basis, getting very personal stories from them about how this program impacts patient lives and communities. And that's why this has become so personal to me as someone that has the pleasure of working with the Michigan Health and Hospital Association. We're an organization that has been around now for just over 100 years. We represent approximately 140 hospitals and health systems throughout the state. And our mission is very simple and very direct. we advance the health of individuals and communities. And that is a mission we're incredibly proud of. And there are a number of things that contribute to that mission. And certainly 340B is one of those most important elements. And if you think about it, rewind the clock 30 years, and that's my time frame at the MHA. I started 30 years ago, and back then, it was a very different environment in Michigan. We had literally twice the number of inpatient hospital beds here in the state. Average length of stay when someone was hospitalized was nearly twice as long as it is today. And a lot of that change is a result of improvements in healthcare delivery. Among them is prescription drugs that have been developed and are available that can help people stay healthy, to help cure a number of illnesses, and quite honestly, to reduce the need for lengthy hospital stays. And so what we want to do as good public policy is make sure that access to prescription drugs is available to everyone in the community, regardless of their financial status or their background. We believe everyone has that right, and we want to make sure that they have that access. 340B is one of those wonderful programs that ensures that sort of access. And so we couldn't be more proud to be a part of this effort. I know later in the program, you're going to hear from two of our MHA members, from Sparrow Health System and from the Henry Ford Health System. Both of those systems are long-standing members of MHA, and they are among the members that I alluded to, which can tell us very, very directly how this program plays out in their organizations, in their communities, and really make a difference to patients. So with no further ado, I really want to make sure you have an opportunity to hear directly from them and our other presenters today. But thank you so much for the opportunity. We will be at your side, and we will continue this important advocacy going forward. Now, Peggy, I'll turn it back to you, and thank you again.
Thank you, Brian, so much. That was terrific. So moving on, I also have the pleasure of introducing you to, if you don't know him already, because everybody seems to know John Chasky. John Chasky from Sparrow, who is a UP native. He is a Sparrow Health System, the guy on government relations. And if you don't know him, he's a really fun person to be with, and he cares a lot about not only the 340B program, but his community. So it was important for us to feature John on this program today, because he has been also a very strong supporter of community voices and the mission that we have of ensuring that the community knows that 340B matters to them, even if some people can't spell 340B. Once they learn from us that 340B is vital to their communities, that's what we're doing today. We're trying to spread that word, and John is one of our very best spokespeople for that. So John, take it away.
Thanks, Peggy. Can you hear me okay? Okay, great. I'm happy to be here today to talk about Sparrow's interest and support of community voices for 340B. When I left the state legislative staff and went to Sparrow Government Relations 12 years ago, I was completely unfamiliar with the 340B program. But soon after, I learned a great deal about 340B and its value to hospitals and the impact it has on a number of communities in Michigan and around our country. The 340B program is always under intense scrutiny and keeps advocates like me and my colleagues really busy in Washington. Congress just always seems to have 340B as a target, and it's important for us advocates to continue to reinforce how important the program is for our hospitals and for our communities. My organization, Sparrow Health System, really values the opportunities we have to constantly educate and re-educate lawmakers, mainly members of Congress and their staffs, on the importance of this program. And I always like to share real life specific stories to help reinforce the messages that we deliver to those lawmakers. So specific to Sparrow and to the Lansing region, we've used our 340B savings to directly impact the medical care for our area's most vulnerable. In partnership with Holy Cross Family Services, formerly known as the Volunteers of America Homeless Shelter, we built a Sparrow Medical Clinic inside the shelter to serve this population. These individuals were typically heavy users of the emergency department, which we know is not the most appropriate place for primary care services, nor the most cost effective. And we were able to manage, or we are able to manage, chronic diseases and illnesses proactively in a familiar setting. And recognizing the importance of this medical clinic, Delta Dental followed our lead and set up a dental clinic adjacent to the medical clinic, just recognizing the importance of dental health in the overall physical health as well. Also, Sparrow partnered with Dean Transportation, which is a major transportation busing company in Lansing, to develop a mobile clinic, which is a state-of-the-art bus that is deployed to healthcare deserts in Lansing. And I call these areas healthcare deserts because they lack so many services that we take for granted: primary care offices, urgent cares, fast cares. And a lot of these locations or areas of town are not on a bus line that would provide easy access to healthcare, primary healthcare locations. So we developed this a few years ago, and we've seen great results measured by the number of people we serve, the types of medical issues we actively manage, and the overall patient or customer satisfaction. In addition, we've received numerous compliments from local leaders, city council, the mayor, county commissioners, as well as state and federal leaders because of the impact that our mobile clinic has had on our community. And neither of these examples would have been possible without the 340B program and the savings that we were able to deploy into these endeavors. And this is exactly why this forum, Community Voices for 340B, is so important to continue understanding, educating, and protecting the 340B program for the future. Today, you're going to learn a lot about the program and how we as community members, and regardless of where you live in the state, can become an advocate and help spread the word about this valuable program to keep it here for the future. Thank you.
Excellent. Thank you, John. Oh, back to me. Okay. So I mentioned this briefly before, but the CV340B's mission and goals is really critically important here. Is what are we trying to do, and where did this all come from? Where this all came from really is that a couple of years ago, we had faced some of the most serious of ever challenges against the 340B program in Congress. And in fighting back against that, what we quickly came to realize is that we didn't have what's called a grassroots presence. We have hospitals, we have clinics, we have other types of healthcare providers who were incredibly important to the program, but the people who were real beneficiaries of the 340B program didn't know what the 340B program was. So the entire genesis of Community Voices for 340B was to engage and educate those of you who might not even know you're getting a benefit of the 340B program. So that's where all of this came from. I lead the coalition work and marketing efforts and work with the field directors like Rhiannon. We have other field directors in the states, and we're looking to expand those efforts to other states. I also should not fail to mention that I work with the inimitable Bill Von Osen. Bill Von Osen helped write the 340B law almost 30 years ago and is really known as one of the foremost experts on the 340B program. We also have others on our team, including Steve Cooperberg, who works actively with CV340B in these now focused efforts on opinion leader forums in the states. This is a good time to also do a commercial break for our board of directors. These are the organizations: Avita, 340 Basics, Maxor, PSG, RX Strategies, and Verity, who were some of the first to come to us and say, this is how we need to do this. This is how we need to educate consumers or end users of the 340B program, if you will, and we'll help you do that. So we couldn't do any of this without our board of directors, and thank you to these organizations for being part of this effort. We also, as I mentioned earlier in the call, and I think Rhiannon has mentioned as well, have sponsorship, name sponsorship from Henry Ford Health System. And if you've not heard of Henry Ford or Henry Ford Health System, I don't know which rock you've been living under. A fabulous group that has been doing amazing work for lots and lots of years. I think we can move on from there because you're going to hear from them. So 340B program, as you saw in the video, was established in 1992, and this was through bipartisan legislation. I'd like to tell the story that I was told by Bill Von Osen, which was Senator Kennedy, a Democrat, and Senator Hatch, a Republican, and staunchly so in both directions, sat down together and said, boy, drug prices are going through the roof. What are we going to do about it? And Senator Kennedy said, well, let's do price controls. We can control drug prices. Senator Hatch, who was again the conservative Republican, said, oh, no, no, no. We conservatives don't do price controls. What we need to do is come up with a different way. Instead of having price controls on drugs, the different way is, why don't we target to the groups that serve the neediest and most underserved patients in the nation? So the 340B program requires drug companies, as a condition of them participating in Medicare and Medicaid, to give discounted drugs to certain safety net hospitals and clinics. So you're hearing from those safety net hospitals and clinics today, and what they do is they use those 340B savings to help their communities. I think one of the beautiful parts of this program is that those hospitals and clinics know their communities best. Speaking with a Republican voice, I would say, why should the federal government tell Henry Ford or Sparrow what to do with their savings? What we should be doing is having them, and they are through the 340B program, reinvesting in their patients and their communities through 340B based on their specific community needs. So over these 28 years, that's exactly what the 340B program has done. And Congress has several times extended the program eligibility to add other kinds of hospitals: children's hospitals, cancer hospitals, rural referral centers, Black lung clinics. But the premise of all of this is that the safety net, who you've heard a whole lot about during the COVID crisis, the safety net is exactly who these hospitals are. And they're the ones who are fighting the fight on the front lines every day, and especially now more during the COVID crisis. Moving on. We have tried, or we thought about, an interactive component to this webinar. So now you've heard a lot of talk from us, and we're going to ask you a question. And you aren't graded on this, so it'll make you feel better. Nobody will know if you got it wrong. But this is our quiz portion. We've got a couple of quizzes scattered throughout this presentation. So this is a true or false. As a condition of selling pharmaceuticals in Medicare and Medicaid, drug companies are required to offer discounts to safety net providers through the 340B program. Think about it for a second. Is that statement true, or is that statement false?
And as we go through these quizzes, I just wanted to let you know that you can use the chat box to interact with us. You can say true or false. And as we go through, if you have a question, you can use our Q&A as well, if that suits you better.
Great. So if I didn't drone out too much, this is pretty much the exact words I used about 5 minutes ago. And the answer is, Rhiannon, true.
True.
So what that means is that there are no taxpayer funds that go to the funding of these discounts. They are directly through pharmaceutical companies. So there's not a Michigan tax, there's not a federal tax to fund this program. It is funded through the drug companies. I mentioned a number of these, but I wanted to make sure you had the whole list. This is the list of organizations that Congress has decided are worthy of being safety net providers in the 340B program. And if you look at them for a second, you'll realize how incredibly important these clinics and hospitals and health centers are to Michigan and frankly all over the country. Just going back to quiz for fun again. You hadn't memorized that list, did you? Okay. Which group is not a 340B covered entity? Ryan White clinics, Black lung clinics, hospitals that have more Medicaid and Medicare patients, physician oncology practices, Native Hawaiian health centers, and children's hospitals. This is a tough one for folks who are just learning about 340B. I know for all our panelists, you know immediately the answer to this. And the chat box, everybody's saying, this is hard. Okay, I see that somebody sent in the right answer, so I'm just going to announce it now. Physician oncology practices. What I mean by that is for-profit physician organizations, businesses run by physicians. Part of the importance of the 340B program, or one of the criteria for the 340B program, is almost all of these organizations have to be not-for-profit. They have to have a mission, a vision, and a tax status that rolls that money back into the organization and back out to the community, and that's really important. So the question we have about disproportionate share hospitals is, and I'm shorthanding this in the quiz, so I apologize for that, but if you have a disproportionate share of more patients who are sicker or older, is kind of the simplistic way to talk about it. So those hospitals who get into the 340B program have to meet strict eligibility criteria, just like all the other groups that have to meet strict eligibility criteria. They're just different. Moving on. Threats to the 340B program. So this is all great. We just sold you sliced bread, right? This is, why could anybody oppose this fabulous stuff? What has happened is the two leading trade associations, as we call them, are national associations for drug manufacturers. Their names are Pharma and Bio, have worked for several years to try to scale back the program and limit what we think is their responsibility to provide these discounts on drugs to safety net providers. The tough years, in particular, the worst years so far, were 2017 and 2018 in Congress, where it was very difficult to fight back what they were saying about the 340B program that we thought were allegations that were patently unfair and wrong, and frankly, we did pretty well. Congress didn't, quote unquote, reform the 340B program because of what Pharma and Bio were trying to do. With that said, they're not gone. They're not stopping this fight. In fact, they're taking the fight to the states, and we're hearing a lot more arguments from pharma and those groups they contract with, known as PBMs. And PBMs have been discriminating against 340B entities, for example, in a number of different states, much to our consternation. And a number of organizations are working very hard to try to prevent those attacks on the 340B program at the state level. So moving on. That's our case. So in general, and an overview and some beautiful opening remarks by Brian and John, I appreciate that. Now we're moving into what we call the provider panel, where Alex and Dawn are going to give presentations about what they're doing. Henry Ford for Alex, and then Dawn in Upper Great Lakes Family Health Center, two very different places, Urban and UP. And I think you'll be entertained and interested to know how they're using the 340B program to better their communities. So I welcome both of you, appreciate your comments before you say them. And Alex, why don't we start with you?
Thank you so much. My name is Alexander Mansour. I'm a 340B compliance officer for the health system and also director of finance for our ambulatory pharmacies, which is part of Community Care Services, a retail arm per se for the entire health system. Henry Ford Hospital has been around for 105 years, and we're a 6 acute care hospital health system, and 3 of our hospitals are designated as 340B covered entities. Our main campus, Henry Ford Hospital, which is located in Detroit. We have our Henry Ford Allegiance Hospital located in Jackson, And we have our most recent addition, our Henry Ford Wyandotte Hospital, which became a 340B CE as a rural referral center. To the left of your screen, you can see the geographical footprint of where our hospitals, our ambulatory pharmacies, and our clinics are located. Amongst our acute care hospitals, the 6 hospitals, we have 80 medical centers and 31 ambulatory pharmacies. And we just recently actually opened one pharmacy up in the MGM Casino, which I believe we're the first health system to do so nationwide. Henry Ford Health System is one of the nation's leading comprehensive integrated health systems. And based on the graphs you can see, our main campus, our flagship hospital, Henry Ford, was in a designated hotspot in Wayne County, which to date still has the highest number of cases and deaths in Michigan due to the COVID-19 pandemic. I can't underestimate the importance of the 340B program to Henry Ford Health System as a whole. It provides us a delicate balance of benefits and expenses that allows us to provide charity care as a not-for-profit health system. And that's important mainly because our Henry Ford Hospital and our Allegiance Hospital, they are located in cities, Detroit and Jackson respectively, that don't have any public hospitals. So our safety net hospitals need to take the brunt of the charity care and other form of uncompensated care to our underprivileged patients in those areas. So over the last, we've been part of the program since the year 2001. So over the last 19 years, we've actually been using the savings that we receive from the 340B program to expand our services to our vulnerable patients and to our patients system-wide. And in a way, the 340B program has unintentionally put us in a better position to respond to the COVID-19 crisis and pandemic that we're actually going through. Next slide, please. So as you can see, before and during the current pandemic, we have a lot of services in place that we actually tapped into and expanded upon to help take care of our patients during this current pandemic. We've always been providing free and reduced cost medications to the underserved across our health system. Using the 340B savings, we've actually managed to embed pharmacists in a lot of our primary care and specialty clinics system-wide to help treat the chronic diseases and expand our patient access through face-to-face appointments, and more recently through our telepharmacy program and telemedicine program that we just vastly expanded over the last couple of months. Since March 15, when the pandemic officially started, we've had tens upon 10,000 cases of telemedicine, and our doctors were actually tapping into our pharmacy so we can provide same-day services. Our prescriptions were actually being delivered to our patients' home. So during the pandemic, they didn't have to worry about seeing a doctor or actually driving to any of their local pharmacies to be able to pick up their meds. The 340B savings helps us cover our bad debt, being in the counties or in the areas we're in. The amount of uncompensated care and bad debt that the system realizes is the 340B savings is minuscule when it comes compared to our bad debt and uncompensated care that we receive system-wide. We also use these savings from the program to lead our community in better health and well-being at every stage of life through regular health fairs, screens, and outreach. We actually use the savings to fund part or most of our school-based health clinics, our youth bill-free clinics, and countless other programs within the health system. Further expansion on the savings, we currently provide charity care and patient financial assistance to cover patients' co-pays, co-insurance, deductibles, and in some cases we provide their entire healthcare costs, medical and pharmacy, through the savings of the 340B program. At last count, we had over 5,000 patients enjoying free meds or discounted meds. And mainly we can do this due to those savings we receive from the 340B program. More importantly now than ever, since a lot of patients have been afraid to actually visit their doctors or see their doctors, we've actually were able to expand on our MTM program. We were calling patients, nurses, pharmacists, and to make sure that they're adhering and remaining compliant with their meds. This entire program was created based on our 340B savings, and I will not hesitate to say that without the 340B savings, we could not have had the medication therapy management program that we have in place today. We actually are able to use these savings too to expand our specialty pharmacy, which is Pharmacy Advantage. We have hubs for all disease states, which consists of a pharmacist, a nurse, and several technicians, where we have a lot of one-on-one interaction with patients to ensure they're remaining compliant with their regimen. With these high-cost drugs, it's very important for a lot of third-party insurances to ensure that their patients remain compliant. We also provided before and after numerous meds to beds, our discharge program to hospitals, and more recently we have almost 40 nursing homes that we actually deliver meds to. And needless to say, with what was been happening in the nursing homes during this pandemic, this is a very important service we can provide to the patients. We expanded our home delivery service. We actually went through a lot of changes internally to make sure all our transactions are touchless / cashless. And there's curbside pickup that we offer now, and we actually offer courier services, and we actually have several of our own drivers to deliver emergency meds to patients in need. Next slide, please.
Oh,
Well, I think that I went through it fairly quickly. So I hope I was able to demonstrate in these few minutes the importance of the 340B program to Henry Ford Health System and how we turn around and pass these savings on to our patients and all the programs we're offering to them. Thank you.
Yeah, thanks, Alex. As a follow-up, I have one question. You had said at the beginning of your slides that 340B somewhat inadvertently created a situation where you were, or Henry Ford was more prepared to handle COVID-19. Do you feel as if being one of the more hard-hit places in America, if you hadn't had 340B, if it would have put you in a worse off position?
Without question, and I repeatedly mentioned this to whoever would listen within the health system, that thanks to 340B, a lot of these programs that we had in place, whether it be the MTM program, the free deliveries, our hubs, that all of these were put in place for, and a pandemic like this could not have been a perfect situation for us to demonstrate to the health system how all of these services are here to help the patients, you know, whether they come into the clinics or whether they feel that, you know, with the stay-at-home order, they still got their entire regimen and treatment due to all the procedures and policies we had in place prior to the pandemic.
Yeah, absolutely.
So we were in a position to hit the ground running.
Yeah. I mean, it sounds like it, and you know, we're thankful here in Michigan for everything that you've done, and for all of the care that Henry Ford has taken of Michiganders, and we're thankful that 340B was able to be a part of that, and really prop up the services that were needed at the time. And just another shout out to Henry Ford Health System. Thank you so much, Alex, and your team for sponsoring our webinar. It has been a pleasure.
Anything for the 340B program.
Awesome. All right.
Thank you so much for that. All right, I think now we're turning to our next provider panelist. Don, are you ready?
I am. Thanks for having me. You hear me okay?
We can hear you.
All right, great. So I am Donald Simula. I'm the Chief Executive Officer of Upper Great Lakes Family Health Center in Michigan's beautiful Upper Peninsula. We, as a federally qualified health center, are one piece of a large puzzle on a national level. So on a national level, there are approximately 1,400 independent nonprofit organizations that make up our community health center network. Last year, we served somewhere in the neighborhood of 29 million people in this country. 1 in 12 people in urban settings receive their health care from a community health center. 1 in 6 people in rural communities receive their health care from a community health center. In the state of Michigan, we have, I believe at this time, 44 community health centers, and across the state of Michigan, we serve 600,000 to 700,000 Michiganders. For us in Upper Michigan, we're in the central and western part of the Upper Peninsula. We serve approximately 25,000 of the 295,000 individuals in the Upper Peninsula. We cover approximately 6,000 square miles. We have 11 locations across 5 counties in the western central part of the Upper Peninsula, all of which are very rural, all of which have an aging population. 340B program for us is essential in our ability to bring primary health care services to our communities. The savings from 340B enable us to do a number of things. As previously mentioned, we, as a community health center, provide all of our services on a sliding fee discount program. Patients at 100% of federal poverty are afforded a 100% discount on services, and those between 100 and 200% of federal poverty have a sliding scale. And the 340B program and those savings allow us to expand primary access to primary care services, help to cover the salaries of many of our primary care clinicians. They allow us to underwrite some of those sliding fee discounts that we offer to many of our patients. They've allowed us to expand services, including dental, behavioral health, to many of the patients in our community. So of our 25,000 patients, about 55% or 60% of our patient population is either Medicaid, Medicare, or an underinsured or uninsured patient population. So the majority of the people that we serve, like all health centers in the state and in the nation, are patients that don't have maybe as liberal reimbursement policies. But, we as community health centers take on the responsibility of advocating for and serving underserved people across all of our communities. And 340B is one of the mechanisms that we use to stretch the very thin margins and resources that we have to ensure comprehensive care to our folks in our communities. Care management services, health centers provide case management, care coordination. My colleague from Henry Ford was talking about embedded pharmacists in our clinics. That medication therapy service is essential. Bringing that pharmacist on into our clinics really ensures that we are maximizing care and being able to provide more comprehensive chronic disease management to our patients, and our physicians work very closely with pharmacists in those programs. Substance use disorder services are now available in many, many health centers and behavioral health services across the country and in the state of Michigan. And in our program, we provide treatment for patients with opioid use disorder, and doing medication-assisted treatment, and 340B is a big part of our ability to be able to get that service out to patients, and oftentimes helps to underwrite the patient's acquisition of those medications as well. You know, we make home visits to patients, you know, in our rural communities. Many of our elderly people have a difficult time traveling. So for those of you who have had the pleasure of coming to the Upper Peninsula, you don't go anywhere without driving at least 45 minutes to get to your doctor. And so, you know, many of our patients have difficulty getting out and getting into the office. And so we do everything that we can to actually bring healthcare to them. Telehealth is a big piece of that, and it's been you know, we've been a user of telehealth services for over 10 years, and the technology has advanced significantly in recent years. But you know, initially when we started, it wasn't uncommon for us to spend $50,000 to $60,000 on a piece of telehealth equipment that brought healthcare to our patients at home. And we've made those early investments. And 340B was a piece of our ability to be able to do that, because the reimbursement didn't exist for telehealth. And so 340B really makes a difference in our ability to update our technology, replace medical equipment, and stay current with trends in the country. So without 340B, I can safely say that you know, our organization would be much less impactful in our community, and we'd be a much smaller organization. We simply could not do all the things we do in our community without the savings from 340B. So that's my position, and I really appreciate the opportunity to come in and share a little bit about what we do and talk about what health centers do across the country and in the state, and the impact we have on Michiganders and folks in the United States. Thanks.
Thanks, John. That was great. I have a follow-up question for you. There's been a lot of changes in telehealth in the regulatory process through the COVID-19 crisis. What do you see for the future of telehealth? Do you think that opens a door for better reimbursement of telehealth, more telehealth? What are you seeing in your crystal ball going forward with telehealth?
Well, I think, you know, I think that ship has left the dock, and the reality for all healthcare providers on a national level, I think, with advancements in technology, the ability for, you know, I think about my recently passed mother, who was lived to a beautiful age of 89, but was a frequent user of FaceTime and text messaging. She was able to connect with her, you know, her providers in the clinic. She had a number of chronic conditions that made it difficult for her to travel, you know, outside of her home to get to medical appointments, and it made a difference in her life. And I think I think telehealth is definitely here to stay. And you know, from a reimbursement perspective, most of our legislative leaders, I think, see the reality and the cost savings that come from funding telehealth services. So I think it's here to stay.
That's great. A lot of us hope you are absolutely right on that one. Alex, I have a question for you on the reopening, right? And that means a lot of different things in a lot of different states and a lot of different places, but what do you expect to see at Henry Ford? A great influx of people who have put off elective surgeries? What do you envision happening over the next couple months for reopening, and the connection to 340B of what's going to happen to you and how 340B is going to, I assume, help you with that?
Well, to be honest, that's an area that's a little bit out of my scope of business, but what from I've been hearing system-wide, they expect it to be gradual. They don't expect it to go back to full force right away. We actually did open up some clinics at the beginning of June. We had 4 clinics shut down entirely. Those are reopening come the middle of June. but we're expecting a gradual increase to get back to hopefully pre-COVID levels by the end of the year. But
That's
no,
helpful
we
to
do
know.
not expect, so, yeah, we expect it to be gradual. We don't expect a huge influx of patients coming in right away.
A massive surge. Or Don, are you thinking the same thing in the UP?
Well, our experience currently is that we have a number of patients who are almost demanding to get back into the office. And what we're finding is that many patients have deferred critical treatments for fear of contracting COVID-19, or because of this, stay at home, stay safe. They weren't sure what they should do, even though many organizations like Henry Ford or us or other health centers that have reached out and communicated with our patients and inform them on how to be screened or to do a telehealth or telephone visit even to manage their conditions. Many of them delayed care, and we're seeing patients that are coming into the office right now that really should have been in the office for life-saving and life-sustaining care during this pandemic. And so we're running on any given day between 60 and maybe 75 or 80% of our pre-COVID volumes. But, all of that is really tethered and around and structured around reducing the amount of and number of people that are in the office at any given time. And so structuring our schedules to allow for adequate cleaning and turnover of the rooms, reducing the likelihood of transmission, between two patients that might be passing in the hall. So we have dedicated entrances for people. We have dedicated exits for people. A lot of our pre-registration and screening is done in advance to the patient appointment. Patients call when they get to the office to inform us that they're there, and we send somebody out to screen them and escort them in. And so there are many precautions that all of us healthcare providers are taking, but there are patients that definitely want to get in and need to get into the office, and so we're going to be challenged to be able to manage this, I think, in a way that one protects staff and the patients and the communities from potential transmission of COVID-19, but also ensures that those folks are getting the health care that they need.
Wow.
What about-
So a whole bunch new challenges you're facing, and perhaps some of the 340B savings could be used to address those challenges, is what I'm hearing.
I think you're right. So, there's an inevitable loss of revenue and the slowdown that there are realities, for us that have most of our costs are fixed costs. And so, we've made a commitment to all of our employees during this pandemic to keep them employed, keep them on, repurpose them, find ways to reach out and connect with our patients. But it doesn't, if you don't have revenue coming in from business activity, that challenges any organization. And 340B is one of those ways that help us to stretch our dollars, our budgetary dollars, and make sure that we're able to care for people in our community.
Helpful.
Yeah, one of my biggest fears is the number of our previous patients that had private insurance at one point. They were employed, ended up being laid off or losing their job because of this pandemic, and then they're going to either be uninsured or apply for Medicaid, and that's going to be another tremendous hit for us financially down the line.
Wow. I'm also thinking about, I know certain facilities, and it depends, but certain facilities are doing COVID-19 testing. Are either of you in that camp? Alex,
Henry
or Don? Anybody do-
Ford Health System is testing its employees at this current time. And I know that our lab, our world-renowned lab, is also putting all the parameters in place to test the general public as well. So that should be up and live very soon if it's not already in place.
Right. There's Ryan White clinics, I know that they can't use the 340B funding to do this. Some of them are doing it anyway. COVID-19 testing, which I think is pretty great. They really are stewards of their communities, and they're a group that we have to work closely with that also know a lot about infectious diseases. So they're, well placed to do some of this testing. So Don or Alex, is there anything you missed or you wanted to add to either your remarks or remark on what the other panelists have said before we get into the advocacy meat of this?
No, I'm fine, but I'll stick around for questions towards the end of the webinar.
Thank you.
But I guess I really can't reinforce this enough. I mean, on a national level, the 340B program is instrumental, not only with community health centers, but with our safety net hospitals. We provide critical care to the most vulnerable people in our country. And right now, during this COVID pandemic, those safety net providers are the ones that are really standing up in communities, making sure that people are getting the health care that they need. And 340B helps us to do that.
That's great. Well, just today, some of those opponents of the 340B program that I talked about released a study talking about, this program is growing explosively. Well, and that's a bad thing. Why? So I like to question that analysis of if drug prices are lower and more services are provided to more people in communities, that was the purpose and the point in the 340B program. If it's grown exponentially, or if it's grown as they're saying it's grown, I question whether that's a bad thing. So more news today. So we've heard a lot today about Michigan hospitals and community health centers and what they're doing and how they're in the epicenter of the COVID-19 crisis. And we have another quiz here that, are they providing free or low cost medications? Are they reducing copays on medications? Are they giving or providing community education and health screenings and mobile health units? All of the above and more. And I hope you all are listening and get this answer right, because it's an easy one. Way to go. I'm seeing chat box, all of the aboves all around. All right. Nice job, guys. Okay, now I'll turn it over again, my esteemed colleague, Rhiannon Marshall, hailing from the fine state of Michigan, to get into the advocacy portion and the peer-to-peer input portion of our webinar.
Awesome. Thanks, guys. Thank you again to our speakers for giving us such a great paradigm for understanding why 340B is important to our community and to our state. It is truly in this time during COVID-19 pandemic, a lifeline for many people, and certainly for our safety net, our healthcare safety net. So thank you for that. I did see someone raise a hand, but then it went down. So if you have a question or a concern, you need some attention, let us know in the chat box. That would be great. So as it says here, I'm Rhiannon Marshall Klein. I am the Michigan Regional Director and the National Field Director Manager for CV340B. I have been doing advocacy work for about 10 years, and I have been working with CV since its inception. And we are very excited to be here in Michigan and doing the good work, spreading the word about 340B. There are several resources and advocacy discussions that we can have about how 340B moves through the healthcare landscape. And we've broken it down into these 5 easily digestible pieces of information. And as you can see here, this is our shareable that we've created. It's an infographic. It's available on our website for anybody who needs it. You can drop your logo on here. You can print it out. You can post it in your health clinic, at your school, in your community area. So the 5 pillars that we have here are 340B helps nonprofit healthcare providers to buy medication at a discount. 340B helps provide more healthcare services to our community. 340B helps healthcare providers to serve more patients regardless of their ability to pay. 340B helps healthcare providers give you the care that you need when you need it. And 340B helps you. All of these discounts are provided without taxpayer dollars. So as we go through this, you can see how this relates to everybody. It's relating specifically to how people who are underinsured or uninsured work with the healthcare system and get the things that they need. We have some great infographics on our website that break these 5 pillars down into separate, easily digestible pieces of information. As we're looking at advocacy in the CV340B space, we have, again, tons of resources on our website. Some of the things that you can talk about in your sphere of influence are writing a letter to the editor. This is a great way to get the 340B message out to everybody. Letters to the editor are often overlooked because not a lot of people get the paper anymore, open the paper and look at it. But it's an incredible resource because now that all of our papers are online and easily shareable, this kind of information can be shared into the ether and gone, and people who you would never think would be able to see it. On our website, we have a petition. As you can see on the right side of your screen, it says sign our petition. It talks about how 340B is essential to our community and how we care about the continuation of the program. That's a really easy, 10-second way to get involved. The third thing is hosting an event. We put this in here. We realize that this is now pandemic, COVID-19 world where we don't necessarily sit in the same room and talk to each other like we did before. So hosting an event could look several different ways. It could look like this, where we're hosting a Zoom. You have a group of community people that you think are really plugged in and would be really interested in how they can protect the healthcare safety net. We can get on a Zoom and have a little meeting. We could do the other day, one of my advocates did a Jeopardy type of a thing with a software that you can put in little questions and it goes through and you win prizes, and it was really fun. So that's the kind of more virtual host an event that we're talking about here. And once we are looking towards the future and hopefully we get past this COVID-19 as a society, we will be doing in-person events again. The next one here is telling your story. So how have you interacted with places like Henry Ford or Sparrow Health? My daughter was born at Sparrow in downtown Lansing, and we have interactions with them all the time because that's where my primary care doctor goes. And so my story is a story of interacting with Sparrow Health and Sparrow Health being able to provide services to my community that are in a great need. So crafting that story and talking about how 340B is really important to the underserved is something that we can work together on. Being a social media ambassador, now more than ever, social media is the premier way to get information across to primarily the younger crowd. So if you are social media savvy and you are excited and have a huge network of people that you feel would be receptive to the 340B message, that's what we're talking about here, being an ambassador. leading a Community Voices team. Here in Lansing, we have a Michigan State University Community Voices team of students who are plugged into the 340B issue and go and talk to other students about 340B. Leading a Community Voices team might look, different to different people. It could be that people, again, that are super plugged in, want to use their energy to help the underserved, and you want to create a team and go out and talk to people about 340B. And in that vein, telling a friend is the most easy part. Hey, I was on this webinar. It was great. Here's what I learned. And here's the website. So these are some advocacy 101s that we can do to get people involved in this message. So at CV340B, advocacy is obviously our main mission, is to talk about 340B, educate people, and then get them to take action. On our website, as I've said, we have several different resources. So we have infographics as the yellow and black one you can see here in both English and Spanish. And then we have a sample letter to the editor, sample email to your member of Congress. We have sign the petition like you saw on the previous slide. And then for people who like a pen and a paper, I like a pen and a paper, I think that's great. We have postcards. If you'd like some postcards, drop me a line on my email. I will send you out some. They're fantastic ways to get people involved, and great ways to also just educate the public, because it does have that information on the front, as you can see on the right-hand side of your screen, and then the petition on the back. So here's a quick poll, and if you can take a second to locate your chat box, which is going to be probably underneath the More section on your top panel there. Take a look at these different ways where you can get involved in advocacy and see which ones you think are the best match for your advocacy life. Do you think that you would be best writing a letter, signing a petition? What do you think? I'm seeing petition. Yep, petition's a great way to get people involved, because once we have those petitions, we can use them when we are speaking to people, policymakers across the spectrum. So we can say to our legislators, hey, this is great. This is a great program. And let me tell you how great it is. All of these people from Michigan, this list of people have signed our petition and said, we care about 340B. This is important to us. This is a matter that we care about deeply, and we want you to know that we want you to protect it. Sign a petition, tell your story. Telling your story is fantastic. So it really brings a tangible way to get the message across. This is how it happens, is through your personal story to other people. Letter to the editor. Yeah, these are so great. Church groups can be a very effective ways. Yep, absolutely. Perfect. So this is our advocacy discussion time, and we've already started this advocacy discussion with the ideas that some people are more comfortable hosting an event. Some people are more comfortable writing a letter to the editor. One of the main ways that we've found is helpful to spread this message is through groups of community people who come together, and being able to come into that group and say, hey, this is what 340B is. So if you're thinking right now, I know that the Kiwanis Club down the street loves having speakers, is always looking for speakers. I bet they would love to hear about this. That's the kind of thing that we want to know. We want to know, where should we go next? Who needs to hear this message, and how can we get this message to them? Does that mean that you know, I can go and we can talk about that, or we can get a group together and we can have somebody from, you know, Sparrow come and talk. John Chasky's always up for talking about 340B. These are all different ways that we can do it. So I'm going to open it up. If you have an idea of some places that you think this message would spread, some ways that you can spread this message, feel free to raise your hand on the participant list. If you raise your hand, I can unmute you, and you can share with the group. If you feel more comfortable chatting in the chat bar, go ahead and do that, and I'll share with the group as well. One of the things that you know, Peggy mentioned here is that church groups can be really effective ways to share the message. We are actively engaging the religious communities in Michigan on talking about this issue, because ultimately members of churches are you know, a large family, a large group of people who are taking care of each other the way that a family would. And 340B speaks to that family connection, because if one of your family can't get the medical care that they need, then the whole family suffers. And so we're very interested in engaging with the religious community, engaging with church groups, because that is a great way to spread the message of 340B and talk about all the good that it does in Michigan.
Rhiannon, if I could just jump in, the faith-based community is so critically important. We're also not just doing this in Michigan. We've got some efforts that we're advancing in Texas, just FYI to folks on the phone. But I would also say to the providers, the covered entities, the clinics, the hospitals who are on the phone, you can use these materials to post at your facilities, which Rhiannon has mentioned. I think that would be more helpful. And I'm curious about the participants on this call. If you saw such a sign at your clinic, would that be a useful tool? Would that be helpful for you to keep seeing it and understanding the importance of the 340B program? I'll give you a minute to answer that. We've got another, I think, interesting point here is that the Detroit's COVID testing in Black communities and supporting protesters to get tested. So the question, I guess, to the panelists, and let's go to Dawn and Alex, if you don't mind, is would 340B cover this, the free COVID testing, in particular in this case, in Black communities? And in particular in Lansing. So I guess that's more your neck of the woods.
This is Alex. I don't think it would cover it directly, but the way the savings are distributed throughout the health system, it would cover some of the costs for us to conduct these tests, you know, in county, as an example.
Yeah, I know that I've had this discussion with a few people, and just like Alex said, the way that the program is structured, it's able to kind of touch everything within testing, but not be a direct line necessarily from the 340B program towards the testing, if that even makes sense. I think what Alex said might have made more sense.
Yeah, I think it is facility dependent, and then there's these federal initiatives and federal funding for other kind of COVID testing. So it's going to be a little scattershot just yet. Alex, John, if you think that's fair, there's no one way to do this, but I know clinics, Ryan White clinics, for example, that are doing COVID-19.
Right. Denise, if you are comfortable, I'd love to have you talk a little bit about, because I see you in the chat here. I'm going to unmute you, hopefully. Unmute, please.
Yeah, these are great ideas.
Promote to panelist. Okay, there's Denise. Are you there? Hey! So just for everybody to know, Denise Crawford is the executive director of Kalamazoo Family Health Center. That's correct title, correct, Denise?
Yes, that's
yes. And she's a wonderful advocate for 340B and has some great ideas here in the chat. So I'm going to let her talk about that a little bit.
Absolutely. So I was just suggesting in the chat that there are several different forums starting to take place. And we all know we're just kind of ending our shelter in place and continuing, particularly here in Michigan, to be careful. So I think the mandate is 100 or less and still maintaining the social distancing and maintaining the mask, et cetera. But within those forums centered around social justice advocacy, I know I've attended some centered around just census education and telling people the importance of the census. Also things such as voter registration, the importance of voting this year, candidacy selection criteria, et cetera, et cetera. But a lot of those various venues, I guess my overall gist is that those would also, because they're often gathering people who care about the community, and it's used as an educational forum, that those could be good areas or places where we also make them aware of the 340B and the benefits of 340B and how it further benefits the community in such a drastic way. So again, just as, you know, from an advocacy standpoint, and a lot of those forums, again, my experience has been that they have an underlying message centered around advocacy, unity, equality, et cetera. I believe 340B fits right into that. And so just another area that we could look at as we are starting to re-engage and get the word out.
Yeah, that's a great point. You know, I think that these places are, just like you said, they're starting from a place of equality. They're starting from a place of service, and the 340B mission is to spread as much of the funding as far as it can go, and be able to really serve as many people as possible. And I think it fits right into that. So that's a great idea, Denise. Thank you. I had a question from Tom Snow. It would seem to be beneficial to communicate what health centers, hospitals in particular community participate in 340B along with any participating pharmacies. That information could be produced regionally to help educate the whole community. And I 100% agree, Tom. We have thousands of 340B covered entities in the state of Michigan. And so as you know, a person who lives in Lansing, I know we've got you know, Ingham County, we have Sparrow Health, places like that across the state. If you live in the UP, we can get you a list for that. If you live in the west side in Grand Rapids, or like Kalamazoo, Denise is in Kalamazoo, or in Detroit, all of those lists are available, and we can certainly do some advocacy around getting those lists out to people. So hopefully that answers the question.
Can I piggyback on that, Rhiannon?
Please do. I just saw. Yeah, please do.
Hey, Tom. all this information is actually on the OPACE database as well. If you log in and type in Michigan, it will show you all the hospitals and CEs registered in the 340B program, as well as all the contract pharmacies, the participating pharmacies in the area.
Yep, and the OPACE.
It's all public information, just so you know, Tom.
Just so that everybody knows what OPACE is that's the Office of Pharmacy Affairs Information System. It is a database that holds all of those covered entity lists. So Tom, I think I've just put it so that you are able to talk if you'd like to. There we go. Let's see. Donald talked about Ingham County Health Department and Health Center is doing Lansing testing. Ingham County Health Department as well as Barry Eaton County Health Department are both doing testing. So for protesters who have been exposed to a lot of other people, those are some places that are going to always be available to them as well. That's back to Ray's question about being able to implement free COVID testing. Okay. Oh, no problem, Tom. He says, sorry, having microphone issues. One thing that I wanted to put out there for everybody, and I will put my email up on here, hopefully, there we go. If you have, you go home tonight, or not going home because you're probably at home or at work, but if you're thinking about this later and you think, oh, this is, there's this group over here that I think could do it, could really use the 340B message, or I'm really interested in this and I want to learn more. My email is here. Feel free to drop me a line and we can set something up. We can have a coffee or something along those lines. We do, I'm constantly in the community, constantly talking to people about this, and I would love to meet you in person and have a more in-depth conversation about advocacy and how we can continue to advocate for the 340B program in Michigan. There's still a lot of work to be done, and we're doing it. So we're extremely thankful that all of you logged on today for our webinar. This is a first step in really understanding the 340B program and moving into a place of advocacy around it.
Rhiannon, I think there's one other question that I think deserves an answer, which is, are there other community health organizations, programs, or legislation closely tied to 340B or safety net healthcare providers that we should familiarize ourselves with to get a well-rounded sense of the 340B program, which is a great question. So
great. Yeah. I
believe it was Alex or Don, one of our provider panelists mentioned this before. We are not alone. CV 340B works very closely with a number of different organizations, and basically the folks on our team, if you will, include a group called 340B Health that represents hospitals in the 340B space. The American Hospital Association is also a huge supporter of the 340B program. Mm-hmm. America's Essential Hospitals is the not-for-profit hospital organization, a group that I told you I'm very closely affiliated with. The Ryan White Clinics for 340B is also an active organization. There's an organization called Let It Be. Let It Be that is run through an HIV/AIDS organization known as AHF. is a wonderful group that has been singing the message, no pun intended, using the Beatles lyrics of Let It Be to focus on the 340B program. So, like I said, hospitals, clinics, hospitals, community health centers. I should have mentioned there's a national association and state associations of community health centers. These Ryan White clinics are probably the biggest players in the space of protecting the 340B program. So anybody I missed or anybody else?
Yeah, we would be remiss to not mention Michigan Health and Hospital Association here in the state of Michigan. They are humongous supporters of the 340B program and are always working with CV340B on all of our different endeavors as well.
And just a point of clarification, CV340B is not a lobbying organization, so we do not advance specific legislation on the 340B program, and that we're in a category of being a certain tax status of a not-for-profit, if you will, organization. So how we lobby, if we lobby, is incredibly limited on purpose. So what we're selling here is really a positive message about the 340B program. Don't shrink it, keep it strong and keep it positive, but there's not a particular piece of legislation that this organization is working on. There is legislation that other groups are working on in the states that I mentioned earlier that are protective of the 340B program. And there is legislation coming from the other side that is trying to harm the 340B program. Those other organizations I just mentioned would be more of your legislative to go, and MHA and others.
Yeah. Yeah.
So thank
Absolutely.
you for that question.
Yeah, that was a great one. Thanks, Joel. You know, I think that Peggy and I can both say that we didn't sleep most of 2017 and into 2018 because the 340B program had become such a hot topic issue. And so right now what we are doing is trying to get the community educated on it and spread the good news, I suppose you could say, about how this is really propping up the healthcare safety net, and how during this time, even during COVID-19, the healthcare safety net couldn't have come through COVID-19 in such a way without 340B.
I think that's a great way to end it.
Yeah.
We're giving you a couple minutes back of your lives. We appreciate those of you who stuck with us the whole time for this hour-and-a-half webinar. And thank you very much for the wonderful comments and thoughts, and the panelists for your terrific presentations. And if you, again, want to contact us, please go directly to Rhiannon, and we will find a time to figure out how we can be hopefully more helpful than we were today. So
Yeah.
Thank you, everyone. Have a great evening.
Thank you, everybody. Have a wonderful day.
Thank you.